How are you today? Welcome to our class, our first class on health economics, administration, and management. Now, this is your and your progress. I do hope that we shall learn a bit of economics in this course. It may not interest as such, but I shall try as whether it suits us in terms of the health setup. Now, it's important for you as a community health practitioner in the making to at least know how to deal with issues of demand and supply of product, especially health products. Also because basically with the health sector, it's more of service industry, but there's also the product industry. We do products like medication and such, like syringes, those equipment that are needed in different facilities, different uses. So related to economics and at least have background information on the STEM, so as we become good administrators when time comes for us to do administrative work in health facilities or health related matters, we be good managers. Now, as an introduction to this course, you find that to this topic today, which are doing introduction to economics, you find that the subject matter of economics lies on the production, distribution, and consumption of economic goods, and how much should be spent on education, health, books, travel, food, or clothing. It's of course a matter of political, social, or simply personal judgment, as well as personal for the economist. However, as soon as people have the necessity to choose between having relatively more in the way of health services at the cost of having relatively less leisure or less to spend on education, they are usually what we say economizing. So one way in which an economy operates is by permitting the price of services and of its goods to reflect the cost of rendering those services and producing the goods. So when this happens, we have a private enterprise economy or economic system, and an alternative method of determining what shall be produced is for the state to plan or dictate industrial and other management boards at the various levels of targets to be aided at. Now, what are the objectives of this course or this unit? By the end of this chapter or this lesson, you should be able as a learner to understand the meaning and purpose of economics. You should be able to explain that term economics, know the major branches and approaches of economics. You should be able to identify and understand the basic instruments of microeconomic analysis. Also should be able to describe the implication of economics for business decision making and its role in changing the performance of national economy. Should also be able to appreciate the importance of economics to the resource allocation, planning, and management of the health sector. Now, we'll begin by defining a few terms in this first topic, a few terms that are related to health economics. Of course, when we begin with the word health, by this time you know that health, basically according to the World Health Organization, that is WHO, stands for the state of complete physical, mental, social, and even spiritual well-being, and not just merely the absence of disease or infirmity. Now, with that, you find that being a whole state of all these areas, then they need care. We all need care physically, emotionally, or mentally. We need care spiritually and even socially. So with our social well-being, spiritual well-being, mental well-being, and physical well-being taken care of, we shall be able to achieve optimum health, and our community shall be safe and free of disease. So when it comes to this topic on community, on health economics and administration, and also management in this course on community health, or this program of community health, you find that it's important because remember, the main focus of community health is to do what? To help promote good health amongst the citizens, and also prevent diseases amongst the populations, and prolong life of the members of different communities. So this means that at the end of the day, we are expected as community health practitioners to have this information so that we can have a better understanding. So health stands for that, and economics basically is a study of how men and society end up choosing to employ scarce resources that could have alternative uses. So we choose to use the resources available to us and utilize them well. And some of these resources could be very scarce. For example, money is not readily available. It's a scarce resource in a way or another. And even medical supplies, sometimes they are quite scarce in themselves. They're quite expensive for you to acquire them. They're quite costly. So it's a study of how men and society end up choosing to employ scarce resources that could have alternative uses. That is by someone called Samuelson. There is also another definition that states that economics is the study of how people allocate their limited resources in an attempt to satisfy their unlimited wants. So the resources are not very expansive, they're a bit limited, but you use these limited resources to ensure that you satisfy your unlimited wants. Remember, I'm not saying needs. Needs usually have three major needs: uh, food, shelter, and clothing. But with wants, we have many things that we would really want sometimes to cope with in life. Sometimes they could be, yes, they're not really necessities, but you see, they're important things that will keep us going. Like the toiletries are very important. And when I talk about toiletries, I believe you understand the toilet papers, um, the makeups for women, soap, bathing soap, and such like, all that is crucial for our day-to-day, the oils and 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 petroleum jellies, you know. Yeah. So as such, economics is the study of how people make choices. People have to make choices because they're saying the resources could be very limited, but the wants, what you need to spend on is very expensive. It's unlimited. So we have alternative ways to come through that to ensure that we choose appropriately. So it is also the study of scarcity and choice. Finally, helps how to use scarce or limited resource. The subject matter of economics lies on the production, distribution, and consumption of economic goods, as I've already stated in the introduction. And we've said that already how much should be spent on education, health, books, travel, food, or clothing is, of course, a matter of political, social, and simply personal judgment. Now, maybe we can briefly look at the branches of economics. So, in a nutshell, what have we said economics is? Economics is broad in itself, and we can say it is the study of how men and society end up choosing to employ scarce resources that could have alternative uses. Because remember, with these resources, much as they're scarce, there are many unlimited wants, there are many unlimited uses that will want these limited resources to be put in use. So it's actually the study of how people make choices, especially in terms of when you have scarce resources and unlimited needs or uses. So about the branches of economics, we have two major branches. We do have macroeconomics and microeconomics. When you talk of macro, what comes to your mind? Macro, what comes to your mind? The guess is as right as mine. Macro means large or huge or big. So there's a major distinction between macroeconomics, which studies the functioning of the economy as a whole, and microeconomics, which analyzes the behavior of individual components like industries, farms, and also households. So micro will deal with analysis of the behavior of the individual components that are utilizing resources or utilizing the scarce resources like industries, farms, and households. But macro, it will study the functioning of the economy as a whole. Now, macro economics is the study of the behavior of the entire economy and concerned with the behavior of the economy as a whole or with the broad aggregate of economic life, such as national output, income, the overall price level, unemployment, and also foreign trade. It examines such historical issues as why did production and prices in some countries and the rest of the industrial world collapse during the Great Depression of maybe like the 1930s. So in addition to helping people in their personal lives, economics is required to understand key national issues and to make progress in dealing with them. So economics plays two distinct roles in promoting the understanding of national economic issues. First, it helps to describe, explain, and predict economic behavior, as for example, it helps us understand the causes of poverty. But for many people, the payoff from such economic knowledge comes when it is applied to a second task, that is of improving economic performances. And this distinction between description and prescription is central to modern economics. So in simple terms, with macro, we're saying it will study the behavior as a whole, or with a broad aggregate of economic life, such as national output, income, the overall price level, unemployment, and such. And that's why you'll find that usually the studies that are done in line with health by the KNBS in conjunction with other organizations, sometimes NGOs, to look at inequalities in Kenya, so as to find out which communities are quite disadvantaged, which communities are faced with the high magnitude of poverty, which ones are impoverished with high magnitudes of poverty. And with this poverty, or about the education levels, our children are able to go to school, and about these parents or these people in this community, how literate are they? What percentage is literate? And maybe like income level, how much do they earn on average? So with all that, macroeconomics will want to focus on that and try to explain why maybe some communities are more poor and what could be bringing about this poverty compared to others. And that is a matter of interest for us as community health workers. About microeconomics, it deals with the behavior of individual prices and quantities, like mostly issues at individual level. And our knowledge of economics helps us to manage our personal lives, to understand society, and to design better economic policies. The role of better economic understanding is guiding our individual lives. In guiding our individual lives, will be as varied as our personalities or physiognomies. Learning about the stock market or about interest rates own finances better, knowledge about the investor and the farmer all need to understand about accounting and regulation to make the highest profits from their businesses. So as who are health practitioners, remember, we'll work in the health sector. It could be a private sector, it could be a public sector. Whichever it is, it has to be managed. Yes, it's still a source of income that will earn revenue back to the government or back to the owners, whether it's a doctor, whether it's just a director of this facility. And you're saying that usually now microeconomics narrows to individuals. It narrows to issues to do with individuals at individual levels, issues to do with individual prices and quantities in terms of products and even services. And we all need this information so that we are aware where we would want to invest, like in terms of stock exchanges. We need to understand where we can invest, and in the stock market, we need to know where we can invest and see how we can perform. Wow. Then you do have normative versus positive economics. That is it a factor of opinion? So in using economics, you must be careful to distinguish between normative statements or value judgments and positive or factual statements. In the world today, yet healthcare systems to be in almost permanent crisis. There are shortages of hospital beds and patients are left to lie in the corridors, while politicians argue endlessly over whether more or less is being spent on the national health system. Why is it that health care is such a controversial area? Why is there never enough money to give us the level of health care we want? To answer these questions, we need to introduce and apply a range of economic concepts. And how can we resolve the kind of dilemmas expressed in these headlines? Remember, like in Kenya, we've always had these issues. And for example, was it last year when we had three prominent people dying in close range out of cancer? We had the Safaricom CEO, the late Bob Colimo. We had the governor for Bomet, Joyce Laboso. We also had the MP for Kibra, Ken, Honorable Ken, I can't remember the second name. And all this, you know, it brought a national talk about matters cancer. And even the senior people, the politicians and senior people in government were like, you know, we need to do something about this. We the chemotherapy, a lot of debate and a lot of blame game here and there, you know, of why we don't have up-to-date cancer centers within our country. And everyone was like, if these prominent people have died out of this cancer, different cancers, and they had received the world-class treatment, what about that common mwananchi, that mama mboga? What about that villager, that Anjiku, you know, that is just earning or living below even $60 a day, you know? So we're saying that when it comes to issues to the normative and positive, positive is about facts and normative is about just value judgments. So here we would want to really look at why would we have such issues being of debate? Why aren't our health systems really equipped and really made in such a way that the people in that given country or that county can benefit from the health facilities to their best? So there's a statement such as specialist in heart lung transplants resigns from the national health system in protest as at lack of funding. It's a positive statement. It can be shown to be true or false, and it's not dependent upon the value system of the observer. Then maybe we can break it down and look at positive economics, now that we've looked at the two statements. Positive economics describes the facts of the economy and what percentages of teenagers you would want to find out how many of these teenagers, of these young people, they have gone to school, they have graduated, how many of them are still unemployed, how many people earn less than maybe $60 per day, live below $60 per day, how many people earn at least $100 in a year, you know, what will be the effect of higher cigarette taxes on the number of smokers? There are questions that can be resolved only by reference to facts, and they're all the realm of positive economics. When we talk about normative economics, it involves ethics and value judgments, and should the government give money to poor people? Should the public sectors, government of the private sector or business provide extra jobs or unemployed teenagers? Should higher taxes or lower spending reduce the budget deficit? These are questions involving deeply held values or moral judgments, and they can be argued about, but they can never be settled by science or by appeal to facts. There simply is no right or wrong answer to how high inflation should be, whether society should help poor people, or how much the nation should spend on defense. These questions are best resolved by political decisions, not by economic science. So with that, with the introduction and those definition of some few terms, maybe we can start looking at the aspect on demand and supply, which is actually a subject that we'll discuss more in our next class. But maybe we could just introduce it so that you can familiarize yourself with it. Have you ever heard of the word demand or supply? I do hope so. Maybe you can take a break before you begin on this, digest the few definitions we've done, and yeah, see if they're sinking or. All right, I almost introduced the concept on supply and demand, but I think that one we can just begin on it in our next class next week. But today, let us just finish up on the terminologies Of course, demand and supply are still terminologies that are applicable. When you hear of demand, what comes to your mind? Demand is basically the need and ability, need plus ability and willingness to pay for a commodity. So if you have need and you have the willingness and that ability in terms of finances to buy something, then we say something is in demand. Yeah. And with supply, it's basically now on the other side, whereby the amounts of a good producer are willing and able to sell at a given price. The producers release given goods and they are willing and able to sell them at a given price. Other terms are health service costs. And with health service costs, just include the staff time, medical supplies, including drugs, bed and food services in the case of inpatients, use of capital equipment and overhead such as water, heating and lighting. These items variable which vary according to the level of activity. For example, staff time and fixed costs which are incurred whatever the level of activity, for example, heating and lighting. In the long run, practically all costs become variable, since those that are fixed in the short run may be variable, may be varied, for example, by opening and closing wards and by building new hospitals and such like. In economic evaluation, all such health service costs, both fixed and variable, are referred to as direct costs. So usually have direct and indirect. I may not feel them, but they really spend that time like that time. Okay, then we have cost borne by patients and their families. This will include out-of-pocket expenses such as travel, any cost resulting from caring activities undertaken by the family. And these are both direct cost items. In addition, these may also be indirect costs, especially in terms of productivity, such as income lost because of absence from work, which is a production loss to the society, and any psychological stress experienced by patients or their families, or both. Then we do have external costs. What are they? These ones usually occur of the experience increased costs because of it. In most cases, these effects are too small and diffuse to merit inclusion in the analysis, but there may be some occasions when they are large enough to require attention. For example, public health legislation enforcing anti-pollution standards or specifying water purification levels may lead to increase in manufacturing costs and consumer prices, as well as providing health benefits. Now we have some types of economic evaluation. One of them is cost effectiveness analysis. Like you want to look at something in terms of cost and how effective it is something. For example, in the normal household, we usually say that it's cost effective, bulk, you spend less, and they'll stay for long. But you buy less, you'll spend more money, and they'll take a short. And not take comes both the costs and consequences of the options need to be assessed. This can be done by cost effectiveness analysis. So you need to plan and see, is it really cost effective for you to purchase certain medical equipment, and could it be cost effective for you to run certain services? Are they bringing in back the income, the money that you put in first, like capital within that business? Is the output fair enough or sufficient enough for you to be able to say that this thing is working, I'm getting enough profit? Because remember now, if you're in business, you're out to make a profit, not losses, unless it's a charity organization and unless it's a non-profit organization. But if it's a profit-making organization, whether it's a pharmacy, whether it's a health facility, then you need to find out whatever we are doing, whether the services you're offering or the products you're giving, are we making a profit out of it? So many cost-effective analyses rely on existing published studies for effectiveness data, as it's often too costly or time-consuming to collect data on cost and effectiveness during a clinical trial where there is uncertainty about the cost and effectiveness of procedures. Sensitivity analysis can be used, which examines the sensitivity of results to alternative assumptions about key variables. Okay, this is much, but it may not really be your area of working, but you just need to understand the aspect of cost effectiveness. Like, by the time you spend money, you should spend the least resources and have the greatest output out of something. So usually the CEA, that is cost effectiveness analysis, is concerned with technical efficiency issues such as what is the best way of achieving a given goal, or what is the best way of spending a given budget. Comparisons can be made between different health programs in terms of their cost effectiveness ratios, like cost per unit of effect. And under the CEA, effects are measured in terms of the most appropriate unidimensional natural unit. So if the question to be addressed was, what is the best way of treating renal failure? Then the which to compare cost per life saved. So as in, maybe you have issues with renal disease. Renal are diseases to do with the kidney, and the renal system basically are the ureters, the kidneys, urethra, where the urine passes and exits from the body. That is the system where waste products exit from the body. So assuming you wanted to confirm that what is the best way of treating this disease, renal failure? And we know with kidney diseases, you'll find that there's chronic kidney failure and or the chronic kidney disease, the CKD, and you just have the renal disease, whereby it has not reached its chronicity, like those levels that cannot be repaired. Because remember, when it's a chronic kidney failure, it may require one to do what? To have a kidney transplant. But usually now, if it's in old age, it may not be cost effective. It may not even, that patient could die because of the immunity that's already gone low, the immunity that has already gone low. So you would want to find out how would we confirm that this mode of treatment for the kidney patients is the best. So you'll do that by trying to check out how many patients have been treated with this method, or maybe assuming that 50. Out of 50, how many have survived? They got totally well and they're now sound, good in their health is back to normal. They have a clean bill of health in terms of renal system. So how many? You say 50. Then you say it's the best. Or you say maybe about 40 of them. So 40 out of 50, that is about how many of them? Is it a 10%? Yeah. But if only 2 survived out of 50, would you really say this is the best method? We need to find out what else could be done. Are we together? Yeah. So you look at the cost per life saved. So if this life was saved, how much was spent on the person? Similarly, if we wanted to compare the cost effectiveness of a program, for example, for screening for Down syndrome, the most appropriate ratio might be the cost per Down syndrome fetus detected. In deciding whether long-term care for the elderly should be provided in nursing homes or the community, the cost per disability day avoided might be the most appropriate measure. So you keep checking out and looking at what is the worst that could have happened. Did it happen? No. So if it didn't happen, how much was used on this? And can it be used on other patients with a similar situation? So the advantage of the CEA approach is that it is relatively straightforward to carry. And it's often sufficient for addressing many questions in healthcare. However, it's not comprehensive because the outcome is unidimensional under this analysis, but often health programs generate multiple outcomes. For example, Down syndrome screening, fetus detected is one outcome, but miscarriages avoided might be another very relevant outcome measure, especially if, say, blood testing is being compared to amniocentesis. But this cannot be incorporated into this form of analysis. So CEA not only assumes that the outcome of the health program is worthwhile per se, but also that it is the most appropriate measure. So a further problem with the CA is comparability between very different health factors detected may be useful efficiency versus amniocentesis. But how will this be compared to, say, drugs aimed at reducing cholesterol? How? So it still has gaps that need to be addressed. But it is working. As per now, it is a bit appropriate and better. Now we have some examples listed here. Examples of measures of effectiveness, like cases treated properly, appropriately, lives saved, life years gained, pain or symptom-free days. We also have cases successfully diagnosed and also complications avoided. Then still, we have another terminology, the cure, cost utility analysis. And this is just concerned with the technical efficiency and allocative efficiency within the healthcare sector. It can be thought of as a sophisticated form of CEA, since it also makes comparisons between health programs in terms of cost-effect ratios. However, the cure differs in the way it considers effects, and these are multidimensional under this form of analysis. Remember, with a cost-benefit analysis or the cost-effective analysis, the CEA, it was more of unidimensional, one way, but multidimensional means it focuses on many other broad areas. So cure tends to be used when quality of life is an important factor involved in the health programs being evaluated. And this is because cure combines life years, that is quantity of life gained as a result of a health program with some judgment on the quality of those years lived, the life years. It is this judgment element that is labeled utility. That's why we said it's cost utility analysis. Utility is simply a measure of what? Preference, where values can be assigned to different states of health relevant to the program that represent individual preferences. This is normally done by assigning values between 1.0 and 0.0, where 1.0 is the best imaginable state of health, that is completely healthy, and 0.0 is the worst imaginable, perhaps death. States of health may be described using many different instruments which provide a profile of scores in different health domains. Another word that we could delve into is measuring quality. And measuring a person's quality of life is very difficult. Nonetheless, it's important to have some means for doing so, since many healthcare programs are concerned primarily with improving the quality of a patient's life rather than extending its length. So we work on improving, like we want an improved health. You are overweight, yes, we want to ensure that you get back to the normal weight. But what about other aspects of your life, psychologically, emotionally, are you okay, So you don't just focus on the quality of the patient's life rather than extending its length. So for this reason, various quality of life scales have been developed in recent years, and we have one that is called the Nottingham Health Profile, which is one quality of life scale that has been used quite widely in Britain. And this comprises of two parts. And the first measures health status by asking for yes or no responses from patients to a set of 36 statements related to 6 dimensions of social functioning. 1, energy, pain, emotional reaction, sleep, social isolation, physical mobility. And these responses are then weighted, and a score of between 0 and 100 is assigned to each dimension. The second part asks about 7 areas of performance that can be expected to be affected by health. For example, employment, looking after the home, social life, home life, sex life, hobbies, and holidays. So the Nottingham Health Profile has been applied, for example, in studies of heart transplantation, rheumatoid arthritis and migraine, and also renal lithotripsy. So in a nutshell, we are saying that with this scale of Nottingham, it helps to put down the profile of people. I think if you've ever gone to a health facility and the doctor would ask you, maybe you've gone there, you are in pain. The doctor is likely to ask you in a scale of 1 to 10, whereby 10 is the stage where you're feeling a lot of pain, extreme pain, and 0 is very mild or very little, or there's no pain. How would you rate your pain? So all those aspects are taken care of. Sleep, could you be suffering from insomnia? Could someone be suffering from insomnia? Could someone be having a lot of emotional reactions, overreactions? Could someone be headed to depression? With all these measurements, it could help. So even with health economics, this scale is important. So as we are able to measure the cost effectiveness of programs and see the cost utility analysis and see if all is well and we are making a good profit at the end of the day. So today basically we're introducing the unit introduction, the topic introduction to health economics. In this unit, health economics and management and administration. So we've looked at the objectives of this topic, and we've also introduced it, and I've been able to explain several terminologies that have been used. We've explained the term economics, and you've seen we have 2 branches of economics, which and which. Can you remember them? We said we have macro and microeconomics, of which macroeconomics means that one that involves studies to do with economies, with a whole nation, with a whole country. But with micro, it is more of narrowed down to the goods and services, the businesses of individuals. We've been able to look at normative versus positive economics. We've been able to break down on such and see how different they are and how they are used. We've looked at the positive and we've looked at other terms like health service cost. We've looked at the cost borne by patients and their families. External costs, we've also looked at types of economic evaluation, whereby we have the cost effectiveness analysis, and that is the CEA, and the CUA, the cost utility analysis. And we've differentiated both, and you've seen how we can measure different situations for effectiveness in terms of the CEA. And also for the CUA, we've seen how we can measure quality in terms of if it's functioning, and we've basically focused on the Nottingham health profile, which has been widely used in the world, especially in Britain, and maybe it could be adopted. I'm not sure if Kenya has used any. Maybe that is a point of reference, or rather a point of research, so that you and I should find out about this by our next class, so that we share out if you found out if there are any other countries that have adopted this, especially Kenya. Are we using it? Or how can we measure the effectiveness of our health facilities? How can we measure the effectiveness of the services that are being offered by doctors, the modes of treatment that are being offered as per different illnesses? Could it be that some of the illnesses are still in the community because the modes that have been employed are the outdated modes? Maybe there need to be a slight modification. And in terms of cost effectiveness, there has to be that analysis. So for you to be a health manager, managing in that health facility, a manager in that pharmacy, that large pharmacy, or that wholesale, a pharmacy that we call them dispensing chemists, whereby you can be able to prescribe drugs, you can be able to, do some these minor tests like the blood sugar tests, the urine test for especially pregnancy. Are you able to do a cost effective analysis test or a cost utility analysis test? So by now, I think you are informed, and I do hope that with this course, you shall be a better manager, you shall be a better administrator when time comes for you to be such, maybe of your own business or of someone else's business. So I do hope that you have understood what we've discussed through, and should you have any questions, kindly feel free to ask me in our next class. Of course, in the next class, we are planning also to learn more about demand and supply. So I would want you to read further on that. Kindly get through the internet, get through some materials and read about demand and supply and see how the information can help you go leap ahead, because we want to move in leaps and bounds so that we can make it in our course. So thank you for your time. I do hope that we shall engage more next week, now that it seems you are not yet enrolled. Yasmin, I know that you've had challenges, but I do hope that by the end of this week they'll be resolved. I tried making calls to you, but they have not been going through. But I do hope that by next week everything shall be resolved and you shall be able to physically attend your classes. Even with your working conditions, I know that you shall try to squeeze in time for our class sessions. So kindly attend, so because attendance shall be recorded, and every time I attend record attendance, it earns you some points and it shall be good for you. So thank you.